Welcome to I Love Pharmacology, and in this session, let us learn about NEET Pharmacology one-liners. So, from the general pharmacology, you need to remember certain drugs and also the concepts. So, there is a concept called as first pass metabolism. Those drugs which undergoes first pass metabolism, they are slow in onset, and basically they are going to reduce the bioavailability of drugs like propranolol. And zero order kinetics is exhibited by a very important anti-epileptic, that is phenytoin, especially at the high dose, because of the saturation kinetics, or enzymes become saturated. And next is the volume of distribution is inversely proportional to plasma protein binding. If the drug is more bound to the plasma protein, that means to say the volume of distribution will be less. So next, coming to the therapeutic index, which is a measure of drug safety, and higher the therapeutic index, safer is the drug. And coming to the agonist, so agonist has got intrinsic activity while antagonist do not have intrinsic activity. So what do you understand by receptor downregulation? So receptor downregulation is a mechanism of developing tolerance to the agonist. So steady state concentration is achieved only after 4 to 5 off life. So importance of enzyme inducers, especially the rifampicin, is a potent enzyme inducer which can decrease the efficacy of the oral contraceptive, thereby it leads to contraceptive failure. Coming to the competitive antagonism, can be reversed or overcome by increasing the concentration of the agonist. The sublingual route is one route which bypasses the first pass metabolism, and it offers the rapid onset of action, because of which we use nitroglycerin sublingually in case of angina. So apart from this, we also have high yield facts from ANS and PNS. Acetylcholine is a neurotransmitter released at preganglionic autonomic nerving. And remember, atropine is a competitive antagonist at muscarinic receptor. Adrenaline acts on alpha as well as beta receptors, and it increases the heart rate by activating the beta 1 receptor present in the heart. So pilocarpine is a meiotic. It is used in the treatment of glaucoma due to its meiotic action. The meiotic means with the pupillary constriction. Neostigmine, which is an anticholinesterase, is used to reverse the agents of non-depolarizing skeletal muscle relaxant. So phenylephrine is a selective alpha-1 agonist which is used to treat hypotension. So scopolamine or iosine is an effective drug for prevention of the motion sickness, where it is used in the form of the patches. It will be applied behind the pinna. So coming to the beta blockers, like non-selective beta blocker propranolol, are absolutely contraindicated in bronchial asthma patient due to bronchospasm mediated by beta 2 blockade produced by propranolol. Coming to tamsulosin, which is a alpha 1A selective antagonist, they are used in the treatment of benign prostatic hyperplasia. Coming to the botulinum toxin, which is going to inhibit the release of acetylcholine at the neuromuscular junction. So next, coming to the some of the important facts or the points on cardiovascular system. So digoxin toxicity can precipitate by hypokalemia. So that's why you should be very careful. You need to monitor the serum electro levels whenever you give a digoxin. So digoxin toxicity is precipitated by hypokalemia. Amiodarone causes a specific side effect that is called as pulmonary fibrosis, which is a serious adverse effect. So coming to the AC inhibitors are contraindicated in pregnancy due to the risk of fetal renal damage, and also they can pour for teratogenicity. Nitrates primarily they act by venodilation and reduce the preload. This is the mechanism of most of the drugs which are used for treatment of the angina pectoris. So coming to the beta blockers or the first line agents for the treatment of chronic heart failure, calcium channel blockers like verapamil are contraindicated in heart block because the verapamil they produce cardiodepressant action. And statin, they're a unique drug which inhibits the HMG-CoA reductase, especially which are active during the night time and decreases the cholesterol synthesis. Clopidogrel is an antiplatelet drug that irreversibly inhibit the P2Y12 receptor. Furosemide, a potent diuretic agent, and it is a loop diuretic agent that can cause hypokalemia as well as ototoxicity. And when we talk about warfarin, which is a oral anticoagulant, it requires a regular INR monitoring due to its narrow therapeutic index. So coming to the respiratory system drugs, salbutamol is a short-acting beta-2 agonist, selective beta-2 agonist used for treatment of acute bronchial asthma. Theophylline, although they have got the narrow therapeutic index, which can be used in the treatment of bronchial asthma, it requires a close monitoring of the serum levels. Montelukast, Zafirlukast, all these belongs to leukotriene receptor antagonist, which will going to inhibit the leukotriene mediated inflammation. Thereby, Montelukast is a very important and famous drug which is used for bronchial asthma prophylaxis. And when we talk about the inhalation corticosteroids, they are one of the mainstay of treatment for chronic asthma. And whenever the patient uses inhaled corticosteroids, the patient must be asked to gargle his mouth after the usage of inhalation corticosteroids. Why they need to rinse their mouth? What could be the answer? Can you type it in the chat box? So the main reason is whenever you give inhaled corticosteroids, they get deposited in the throat, and these can lead to increased risk of fungal infection, especially candidial infections, candidiasis. So next is the ipratropium bromide, which is an anticholinergic drug, which is a bronchodilator, which is used in asthma as well as COPD, and these are used in the form of inhalational agent. Codeine, which is a centrally acting antitussive, means it decreases or suppresses the cough reflex, and they're useful in case of dry cough. N-acetylcysteine is a very important mucolytic agent that breaks the disulfide bond which is present in the mucus. Omalizumab, a very important drug, which is a monoclonal antibody. They are used for severe bronchial asthma. Cromolyn sodium, they are going to stabilize the mast cell and prevents the release of the histamine. Dextromethorphan is again a over-the-counter antitussive drug which acts on the cough center which is present in the medulla. So basically, dextromethorphan will going to reduce the cough reflex and they act as antitussive which are useful for dry cough. Next, coming to the endocrine, insulin is the only hypoglycemic drug that can be used in the treatment of type 1 diabetes. And metformin is a uh, what we can say metformin is a known drug across the globe and is the first line oral hypoglycemic agent for the treatment of type 2 diabetes. So levothyroxine is a drug of choice for chronic hypothyroidism. Levothyroxine is a T4 which is having a property of slow onset of action and longer duration of action. Propylthiouracil is a drug of choice or the antithyroid drug of choice during the first trimester of pregnancy to the hyperthyroidism. Glucocorticosteroids like prednisone can cause hyperglycemia, and they are more prone, or they can precipitate diabetes mellitus. Coming to the oral and contraceptives, which contains the combination of estrogen and progesterone to prevent the ovulation. So bisphosphonates are used in connection with the osteoporosis. So bisphosphonates are used to treat osteoporosis by inhibiting the osteoclastic activity. Fludrocortisone is a mineralocorticoid which are used in Addison's disease for for its aldosterone-like effects. Coming to the somatostatin analogs like acroleotide, which are mainly used in the treatment of acromegaly and carcinoid syndrome. And very important drug not to forget is the potassium sparing diuretics like spironolactone, amiloride, eplerenone, triamtrin, etc. Here, spironolactone is a aldosterone receptor antagonist which are used in hyperaldosteronism and in case of heart failure. So coming to the important facts about the antimicrobial agent, penicillin G is the drug of choice for syphilis. Vancomycin is a preferred or drug of choice for methicillin-resistant Staphylococcus aureus infection. That is, vancomycin is a drug of choice for MRSA infections. Fluoroquinolones should be avoided during pregnancy. What could be the reason? Due to the risk of cartilage damage in the fetus. Coming to the metronidazole is effective against the anaerobic bacteria. And when we talk about ceftriaxone, is one of the popularly known and commonly used drug for the treatment of bacterial meningitis. When we talk about the aminoglycosides like gentamicin, they are more prone for causing nephrotoxicity and ototoxicity. Tetracycline, again a very important drug but deadly drug among the children and pregnant women. Tetracyclines are totally contraindicated in children and pregnant women due to the risk of tooth discoloration, etc. Linezolid is used for whenever there is a vancomycin resistant enterococci infection. So this has to be remembered from your exam point of. That is, linezolid is used for vancomycin resistant enterococci infections. Coming to the rifampicin, again, which is a more or a potent enzyme inducer, and it can reduce the effectiveness of the other drug because it metabolizes the other drug very quickly. Clindamycin is associated with high risk of Clostridium difficile associated diarrhea. So when we talk about the cancer chemotherapy, we have a drugs like cyclophosphamide, which is an alkylating agent, and they are known for causing hemorrhagic cystitis. Methotrexate, which inhibits the dihydroterate reductase, and they are used in cancer and autoimmune disorders. Tamoxifen, again, is selective estrogen receptor modulator and used in estrogen receptor positive breast cancers. And cisplatin is mainly associated in nephrotoxicity, and the patient requires adequate hydration, drinking more waters, etc. Doxorubicin can easily cause cardiotoxicity, and it limits its accumulative dose, limiting its accumulative dose. So doxo means धड़कन में जलन होता है और पेन होता है. Doxo means dill, so that means doxorubicin will cause cardiotoxicity. 5-fluorouracil is a pyrimidine analog which is preferred in colorectal cancer. Imatinib is a tyrosine kinase inhibitor used in chronic myeloid leukemia. Bevacizumab is anti-VEGF monoclonal antibody, vascular endothelium growth factor monoclonal antibody, which is used in various cancers. Vincristine causes neurotoxicity but not bone marrow suppression. Herceptin, which is a trastuzumab used in the treatment of HER2 receptor breast cancer. And recently, trastuzumab has been also obtained FDA approval for the treatment of lung cancer, that is the non-small cell lung cancers. So next, coming to the CNS, as you know, levodopa is a drug of choice in Parkinsonism. It is a most effective treatment for Parkinson's disease, but it can cause motor fluctuation with long-term. So phenytoin follows zero order kinetic at high dose, and rest of the time it can require a monitoring. And lithium is a drug of choice for bipolar disorder, and also it has got narrow therapeutic index. Lithium is a drug of choice for where bipolar disorder. So haloperidol is a typical antipsychotic drug associated with higher risk of extrapyramidal symptoms. And SSRI, that is selective serotonin reuptake inhibitor like fluoxetine, or first-line agents for major depressive disorders. And valproate is a broad spectrum anti-epileptic drug, which can it's a as we told, valproate being a anti-epileptic drug, it can be used for generalized seizures. All the type of seizures can be treated with valproate. So midazolam is a short-acting benzodiazepine mainly used for procedural sedation. And clozapine is an effective antipsychotic, atypical antipsychotic for the treatment of resistant schizophrenia, but it can cause agranulocytosis, because of which clozapine, whenever administered, it requires a close monitoring. So zolpidem is a non-benzodiazepine hypnotic used for short-term treatment of insomnia. Next is the rivastigmine. Rivastigmine is a cholinesterase inhibitor used in the treatment of Alzheimer's disease. And next, moving on to the cardiovascular system, extended cardiovascular system. Amlodipine is a dihydropyridine, which is a calcium channel blocker that primarily causes vasodilation. Enalapril is a ACE inhibitor that reduces the mortality in heart failure patient. Nitroglycerin is used sublingually for the rapid relief of the angina pectoris. And losartan is angiotensin receptor blocker and does not cause cough, unlike the ACE inhibitors. Verapamil is contraindicated in patients with severe heart or severe ventricular dysfunction. And moving on to the hydrochlorothiazide, which is a thyroid diuretic, is used in hypertension, but it can cause hypokalemia. Spironolactone, again a potassium sparing diuretic that can cause gynecomastia, but which is not seen with the eplerenone. Atorvastatin is a statin used to lower the LDL cholesterol and reduce the cardiovascular risk. The orbitamine, which is a beta 1 agonist, is used for treatment of acute heart failure or to improve the cardiac output. Clopidogrel is an antiplatelet drug which is used to prevent thrombotic event in patients with chronic artery disease. So next is the facts about the GAT. Omeprazole is a proton pump inhibitor that inhibits gastric acid secretion. Sucralfate forms a protective barrier on ulcers and used in peptic ulcer disease. Loperamide, which is a opioid derived drug, or it is a opioid receptor antagonist. Loperamide uh, can be used in the treatment of non-infectious diarrhea or diarrhea by reducing gut motility. Metoclopramide, which is a prokinetic agent, which can enhance the gastric emptying and can cause extrapyramidal side effect. Ondansetron, a beautiful drug which inhibits or blocks the 5-HT3 receptor, and they are used for preventing chemotherapy-induced nausea and vomiting. So urodeoxycholic acid is used in the treatment of primary biliary cholangitis, Mesalamine is used to treat the uh, inflammatory bowel disease, and octreotide is used in variceal bleeding due to its splanchnic vasoconstrictive properties. Misoprostol is a prostaglandin analog used for NSAIDs, induced gastric ulcer prophylaxis, and also lactulose is used to treat the hepatic encephalopathy as it reduces the ammonia level. Coming to the autocoids, as you know that histamine is a potent vasodilator released during allergic reaction. H1 receptor antagonists like diphenhydramine are used to treat allergic rhinitis and urticaria. Loratadine, which is a second generation antihistaminics, which has got minimal sedation, and serotonin is a key neurotransmitter which are involved in mood regulation and its target for antidepressants. Ondansetron, again a 5-HT3 antagonist used to prevent nausea and vomiting associated with chemotherapy. Prostaglandin, like prostaglandin E2, cause vasodilation and are involved in inflammatory process. Aspirin mechanism of action is it irreversibly inhibit COX-1 and COX-2, thereby reducing the synthesis of prostaglandin derivatives. Montelukast is a leukotriene receptor antagonist used to treat the bronchial asthma as a adjuvant drug. Misoprostol, which is a prostaglandin E1 analog, used to used for prevention of the uh, non-steroidal anti-inflammatory drug induced gastric ulcer. So misoprostol is contraindicated in pregnancy because of the NSAIDs induced gastric ulcer. Bradykinin is a potent vasodilator that increases the vascular permeability and causes pain. So this was about class on just a glimpse of the important high yield facts that can become handy as well as helpful for your coming exams. If you find this video useful, please do subscribe to our channel I Love Pharmacology for more updates on. Thank you.